there. Hi, no, don't move, it's okay. My name is Sonia. It's nice to meet you. I don't believe I saw you when you came in before. No, we didn't meet before today. Well, it's nice to meet you. I don't know if you really know why I had to come in here today. It looks okay. Alright, you were admitted over the weekend. You were admitted on a Saturday. Right? I'm going to set my portfolio aside for a moment. That's okay. I'm just going to step around you here. I don't want to... You don't have to move. You don't have to move, certainly. Let me check that. Okay. That's alright. I'm going to get it around your shoulder. There we go. Is that better? Okay, I want to make sure it doesn't get blocked or anything. Let me just talk to you a little bit about what's going on, okay? Your situation is a little different from the typical patient that we receive, as you probably know. I'm going to set my clipboard here on your bedside stand. I'm going to look at your chart for a minute. Now you have come to us from, wow, you're kind of a long way from home, aren't you? What brings you here? Right, family here. Okay, well that's okay. That's your parents. All right, that's good. Well, as you know, you're not allowed to have visitors for the first 14 days. Right. And we also do not allow any contact. We don't allow phone calls, letters, anything, email, anything for 14 days. So you're still in the middle of that period. After that time, of course, depending on how your treatment progresses, you may be allowed some visits, phone calls during scheduled hours, but we will have to see how things go. You're still relatively new here, and we're going to see how you progress during the next 2 weeks. Great. Now, I'm here to help with some of your situation, some of your issues. Right. I am a physical therapist, and I also want to sit and talk to you a little bit about how you came to be in this situation. As you know, we are all cross-trained here to handle different aspects of your treatment, and that's part of my job, is to just talk to you and get an idea of what led to this point. Okay. Well, that's wonderful. That's great. We like to help people who initiate their own treatment. Most of our patients do not. Most of them are not volunteer. They're not here voluntarily. So the fact that you realize that you needed help is good. A lot of people don't. A lot of people come here against their will. They're here because a judge sent them here, or they got into some trouble with the law, or something happened at home. So I'm glad to hear that. The first thing I want to listen to your heart. I want to listen to your heart rate. I just want to listen to your heartbeat. Okay? So just relax and stay. Would you like another pillow? I know you have to stay. You have to stay in that position. I understand. Well, I will work around you. You stay still. Would you like? It looks like you have some pillows down here. I have one that's kind of thick but small. Would you have any use for this, or would you like a thinner pillow? Okay, there is a thinner pillow down here. It's a bit larger. See, it's kind of heavy too. I'm going to put this... Okay, you just hold still. Hold still. I'm going to put it right behind you. Don't move your head. Don't move your head. I'm going to simply lay it. They already have one back there. I'm going to put it right here. How's that? Is that good? Okay. I want you to be comfortable. Comfortable? Okay. Now, it's okay. I'm going to place this on your chest in several different locations. I want you to breathe normally. No talking. Okay, can you take a deep breath for me? I understand that there's pain. There will be pain with your shoulder. That's okay. I'm sorry. It's going to be a little uncomfortable. Can you take another deep breath for me? Thank you. Okay. All right. I'm going to set this down for a second. I'm going to come around you here to the other side. Now, I've got your tube here. You do understand the purpose for this. Okay, the doctor explained it to you. Okay. I want to make sure it's flowing properly. I have to do some work on your shoulder today. It is not going to be comfortable. As you know, physical therapy can be very challenging, but very healing work. And it's not always comfortable. It's not like a day at the spa. So you and I together are going to work on this. I will be coming to see you every day around this same time, at least for the next 7 to 10 days, according to what your doctor wants to do. And during that time, we can also talk about different things that may be on your mind, things that led up to this point. All right? That's what I want you to do. Of course, I want you to stay there. You're not going to have to get up. You're not going to have to move. We will get into that later. At this point, your situation is still a little delicate. I don't want you to be moving around a whole lot. Now, if you need to use the restroom, just let me know. We will page the nurse to come in. I will not handle that myself, but if you need anything like that, just let me know, and we can stop, and then we can continue the therapy afterward. Great. I'm going to ask you to relax as much as you can. Just relax your body. Relax your shoulders. Relax your arms. I'm going to apply a little bit of pressure to your shoulder on the top. I'm going to push down on it. Okay. Yes, it does. How about here? How about this area? Okay. Now I'm going to come around to the side of the bed and move my clipboard. I'm going to massage the top of your shoulder. It's going to start out soft, but it's going to become very firm, and you will experience discomfort. Here we go. Okay. It is definitely there. I can feel that. Okay, just relax and breathe normally if you can. Just hold on to it. There we go. I'm going to apply some light pressure to the side of your neck over here on the left. And I want you to tell me when this hurts. Right here. No. I'm going to press right along here. Okay. Can you describe the pain for me? Right there. Kind of a sharp pain. Okay. You feel it in your leg? I'm going to try that one more time. When I press here, you feel a sensation down in your left calf. Okay. Is it right here? Okay. All right, I'm going to make a note of that. On a scale of 1 to 10, how painful or uncomfortable would you say that is? Is it more painful or uncomfortable? When they brought you in, you were in a wheelchair, right? You were not walking. So have you experienced this pain before now? No. All right. Now, I want to bring your arm out straight, right here. And I want you to rest your arm on the side of the bed. Just lie it here next to your leg. I'm going to squeeze your arm here in different places, and I want you to tell me when it becomes painful. Not uncomfortable necessarily, but painful. All right. Now don't extend, don't bring your arm up. Just leave it, just let it rest on the bed. Right here. Okay. I'm going to come down to your elbow, just above your elbow. All right. Now I'm going to take your forearm. I'm going to hold your forearm, and I'm going to bend it slightly as if we were resting your arm on your lap. Okay. Bring it forward. And bring it back. Do you feel any discomfort or pain? No? All right. Let's try something else. I'm going to slowly bring your arm up. Like that. I want to extend it as far as possible before it becomes too painful to continue. Okay, I'm going to slowly bring it up. Okay, that's about a 45-degree angle. Is that as far as you can go? I'll bring it back down. I'm going to try one more time. Here we go. Okay, and back down. I'll bring it up again. And down. Now this time I'm going to apply some pressure to your shoulder. I'm going to squeeze right here while we bring your arm up again. And I want you to tell me if this is better or worse, if it helps or makes it worse. I'm going to apply pressure on your shoulder and bring your arm up. Okay. I'm going to do it one more time. Pressure and bring your arm up. Is that better? All right. I'm going to come around to your other side, just to get a feel of how this. Now your right side, you should not experience any problems with your right side. I'm going to try the same thing over here that we did there. I'm going to apply pressure to your right shoulder. I'm just going to press down. Okay. How's that? Okay. Now I'm going to massage. I'm just going to knead into the muscles in the top, just right up in here. Now tell me how this feels. Okay. No pain. All right. I'm going to extend your arm, your right arm, straight out. Now rest it on the bed. I'm going to massage your upper arm. Just little pressure, little firm. No pain. All right. I'm going to do your forearm. That's good. Great. Now I'm going to extend your right arm up. Looks like you have good range of motion. Is there any pain or discomfort here? No? Okay. I'm going to apply pressure to your neck on this side. And you tell me, I'm going to apply it in different areas, and you tell me if there's any pain or discomfort, any tingling sensation, any sharpness, any sharp pain, dull pain, anything. Okay. That's what I figured. So you're good on the right side. That's what I expected. Wonderful. Okay, well, we are going to do a few more arm extensions on your left side. We are going to have to do these every day until your range of motion improves. It is necessary. It is going to be a challenge for you, and I will work with you. I have patience, but I also understand that sometimes I have to do things that you may not want me to do, and that's just part of the process. Okay. All right, and we're going to do it again. I'm going to hold your arm. I'm going to grab you here on your shoulder and just apply a little pressure when we bring your arm up. And I want you to come up as far as possible before it just becomes too painful. Okay, that's good. Down. And one more. Good. And down. Up one more time. That's okay. Take a deep breath and down. Excellent. Now, I would really like to get a feel right under here. I'm not going to apply a lot of pressure. I'm not going to do much. I just want to get a feel for this area, right? Just below your underarm. So I'm going to ask you to just set your arm, just give me a little space right in here. And I'm going to put both my hands here. I'm going to keep them flat for a minute. And I'm going to press in. Okay. You have some swelling right there. It's just around the lymph nodes. You have lymph nodes under your arm. You have some swelling there. I'm going to have to make a note of that also. We need to let the doctor know about that. They're going to want to check that out. That could be important. All right, I did not see a note. Oops. Sorry, chart. I did not see a note in here about that. Now, of course, you were given a preliminary examination when you were admitted, and everything is in here about that. But yeah, the doctor's definitely going to want to look at that. Now, you understand. Can you explain to me what you know about your situation? You understand how serious it is. Okay. But there is hope. There is hope because you came here on your own. You called your parents and they made arrangements for you. And we are certainly very supportive and very glad that you did that because we can help you as long as you help us help you. All right. We have been in touch with the insurance company for the car. And they are not allowed to contact you. They understand that. They have been in touch with your parents, and they are working out some preliminary stuff about the wreck, and they will be in touch with you after the 14-day period is over if you are allowed to contact with anyone. And that still remains to be seen. That is beyond my power. I can't decide that. But they will consult me before they make that decision. So... all right, we will do that. We will absolutely do that. Once you are able to get up and move around, we can do more. We can start to work more on your range of motion with your arm. I know that there are issues with your rotator cuff we will have to keep in mind. We cannot give you that. They can prescribe alternative medication for the pain, but that is also not up to me because of your history with Percocet. That's right. We can't give you that. We will give you something different for the pain. Unfortunately, it may not be what you want. It may not be as strong as you would like, but we have to work within certain parameters here. All right. I am not allowed to disclose that. I'm sorry. Okay, I'm going to do a little bit more massaging. I'm going to do some deep tissue massages of your left shoulder and this entire area up here. And then I'm going to give you a little rest, and then we're going to do it again and work on your range of motion. Okay? I'm going to put my clipboard over here. Just on your little table. All right. Now, this part is going to be a little more. It's not going to be quite as easy as what we just did. The deep tissue massage will not be comfortable. I'll just let you know that now. But I want you to try to relax. Remember to breathe. Don't hold your breath. Try not to tense up. Try to relax as much as possible. I understand that it's not always possible to do that. Believe it or not, I have had to have this done myself. I was also in a wreck about 10 years ago, and I had to go through something very similar, only it was with my right hip. So trust me, I understand. All right, now we're going to begin. I'm going to massage the area just on your shoulder where I started a few minutes ago. But I'm going to apply much more pressure, and I'm going to go around to the back, on over just above your shoulder blade. But I want you to stay in this position. I don't want you to try to sit up. I will bend over, and I will do this here so you don't have to move. Okay, are you ready to begin? Okay, here we go. Yes, okay, you're doing great. You're doing great. I'm gonna have to dig in, I'm afraid. I did trim my fingernails, so I'm not gonna scratch you. That's one thing in this business, you have to keep your fingernails relatively short so I don't hurt people. Okay, now breathe. I'm going to stop for a minute. I want you to breathe. Okay, you're holding your breath. Don't hold your breath. Here we go. I'm going to come around just above your shoulder blade. Okay. All right, we're almost there. Okay. Okay, I'm going to stop. Now, I'm going to grab your shoulder just up here. I'm going to apply some pressure, and we're going to bring your arm up again. Let's see. I'm going to check your range of motion. It will feel different now. Okay, you're doing fine. You're doing fine. You're breathing. That's good. That's very good. Okay. You will experience some soreness tonight. You may have a little trouble sleeping because this area, I understand, is already tender and you're already having some difficulty, but you will experience more soreness. One more time. Come up. Okay, and down. You will experience soreness like a big bruise that you didn't have before, and that is going to get worse before it gets better. I'm going to do the deep massage again, focusing more this time on sort of the rounded outer part of your shoulder, and I'm going to work just this part. There will be a lot of pressure. Here we go. Remember to breathe. Okay, that's good. That's good. No, don't round your shoulders. Don't. Just try to keep them as relaxed as possible. Okay, there. Excellent. Let's do the range of motion one more time. I'm going to apply pressure to your shoulder again at the top, and up and down. You're doing great. Up and then back down. Now, I want you to rest for a minute. We're going to stop just for a few minutes, and then we're going to do it again. Okay, we're going to do 3 sets. We've already been through the first one. We're going to do 2 more sets today. And tomorrow we may see about increasing that. You will have, our sessions will get longer as we go along. Okay. While we wait, I see that you have a magazine over there. Would you like me to read an article to you? Okay, I would be glad to, certainly. All right. It looks like a People magazine here. Is there anything in particular that you would like me to read? It'd have to be something short, because remember, we can't pick a long one because we have to do your other 2 sets, but we can start something or pick a short article. Let's see. Looks like it's mostly pictures. I don't read these things. I'm not exactly sure. I don't really read these types of things. So I'm not exactly sure what to read in here. Okay, here's one. On Prince Harry and his emotional mission. And this is Prince Harry right here. As she made a 1,000-mile, 72-day trek around the UK with fellow wounded veterans, Kirstie Ennis had been leaving dog tags in memory of her fallen U.S. Marine comrades. So when she arrived at Buckingham Palace on November 1st, The Florida native knew exactly where the memorial should go, into the hands of Prince Harry, who had previously joined her for a 17-mile stretch of walking with the Wounded's Walk of Britain. He was reluctant to take it, says Ennis, 24, who has undergone 38 operations since a 2012 helicopter crash in Afghanistan, but I told him he had to. The former British Army captain, 31, accepted the gift with a giant hug, just as he has embraced his key mission to help wounded warriors. Harry is one of the lads, says a friend. He speaks the veterans' language. On October 28th, he met with President and Mrs. Obama to launch his Paralympic-style Invictus Games, which will kick off in Orlando next May. The support has been amazing, he told People last month. It's clearly a personal issue for the royal, who has joined his brother Prince William and sister-in-law Kate in shining a spotlight on mental health. At Fort Belvoir in Virginia, he touched on the horrors he'd witnessed in the Army, including the invisible injuries to the mind. He talks thoughtfully, says former Marine Andrew Bennett, who suffers from PTSD and walked alongside Ennis. He did two tours of Afghanistan, and you can only imagine what he has seen. Wow. That's interesting. Okay, I'm going to put this back. All right. We're going to do it again, okay? I'm going to do the same two things that I did a minute ago. I'm going to massage, get that down deep. I'm going to massage quite hard on your shoulder, back toward the part just above your shoulder blade. Okay? And again, I want you to remember to breathe. Don't hold your breath. Don't tense up. Don't round your shoulders. Just let them drop. Let them relax. All right, here we go. And pressure, lots of pressure. Drop your shoulder down. Don't tense your shoulder up. I feel you fighting me. Let it go. Let it go. And remember to breathe. I'm going to move around just above your shoulder blade. There we go. You're doing great. Just keep breathing. Okay. Okay. Now I'm going to stop. I'm going to let go. Take a deep breath. There you go. You're good. You're good. Okay. You're good. I'm going to do that one more time, and then I'm going to do a little bit more right here. All right. So here we go. Pressure again. I'm going to get down deep in there. Okay. Don't hold your breath. There you go. And back to the back part. I'm just pushing in with my fingertips right now and just sort of digging in there. Okay. I'll let go. All right. Good. Okay. I'm going to do right here, just on the rounded part of your shoulder and down in here a little bit. Okay. Just working in there, getting down in there. This is a little bit better. Okay. There you go. All right. Now, we're going to do the range of motion again. I'm going to grab here. Just relax your arm. I'm going to hold your arm right at the elbow in my hand, and we're going to bring it up like that, just like we did a minute ago. You ready? Here we go. Up, pressure, and back down. And as I bring it down, I will slowly release the pressure on your shoulder. And up a little more. Can you do a little more? There you go. Good. Then down. I'm going to do two more. Pressure, and up. Okay, that's fine. And down. And release the pressure. One more. Okay, pressure here. Up. Can you hold it for? There you go. There you go. Very good. And down. Fantastic. Great. I'm going to let you rest one more time. We'll read one more thing, and then you will have your third and final round. As I said, when I come back on subsequent days, we will be doing more cycles of this, and we will also start on examining this area after the doctor has a chance to examine that swelling. I am a little concerned because it is in the area of your lymph nodes, and I want to just make sure there's nothing going on there before I start doing any work in that area. All right, let me get the magazine again. Okay. So what part are you from originally? Okay. Yeah, you know, my brother goes fly fishing up there. He says it's beautiful in the fall. I've never been there myself. No, I've lived here all my life. I grew up in the Panhandle. Yeah, not far from there at all. Okay, let's see. Wow, that's a long article. We're not reading that one. There has to be something in here that's short. It's not that one. I have lots of recipes and things. Let's see. The problem is there's so many inserts in these magazines that it just flips to certain pages and it's hard to get past it. That's too long. Okay, we will read about Kim Zolciak Bierman. I have no idea who these people are. I don't really keep up. I don't watch television that much. I mean, well, I watch a lot of Netflix and Hulu and things like that, but I don't watch regular TV. So for me to say I don't watch television is a little misleading. I watch more than I should probably. Okay. The Kim Zolciak Bierman. I'm lucky to be alive. It's a very pretty lady. An undiagnosed heart condition left the Bravo star and DWTS contestant angry and grateful. Kim Zolciak Bierman knew competing on Dancing with the Stars would be challenging, but she never could have foreseen this. The show saved my life. Just after flying home to Georgia on September 23rd, following a grueling practice with partner Tony Dovolani, the mother of six, wow, she has 6 kids. The mother of 6 started to go numb. It felt like a million ants were crawling over my body, says the 37-year-old star of Bravo's Don't Be Tardy. My tongue went numb and I couldn't talk. I do these Jim Carrey impressions, and my daughter Brielle thought I was doing that. A CAT scan revealed she had suffered a stroke. And doctors soon revealed to the former Real Housewives of Atlanta star and her husband, Atlanta Falcons player Croy Bierman, that there was a hole in her heart requiring urgent surgery. Now recovering, Zolciak is grateful and hoping to return for the finale of DWTS. At first I was angry, like, why now, says Zolciak, of having to leave the show abruptly. I had a pity party for an hour. Then I had my coffee and I was just like, oh my God, Kim, you're really lucky. Okay. See, we all have things that happen to us that we don't expect. I think we all get comfortable in our lives. I think you were comfortable in your life for a long time. And we have the ability to gloss over things and miss things that are important about what's going on with us and the people in our lives. Until something happens, something drastic, like your car crash. Right, and that serves as a real wake-up call. And I believe that's what's happened for you, which is why you're here now. And right, and sometimes I think it takes something very shocking to wake us up from our hypnotic state. So we are very glad. We're certainly not glad that you had a crash, but very glad that you woke up from it. Okay, now we're going to do one more round, and then I will let you get some rest. And again, remember, tonight you will feel soreness in there that will be worse than what you've felt previously since you came here. I understand you do have some soreness from the wreck, but this will be worse. Unfortunately, it will get worse as the days go on. It's going to get worse before it gets better. But you'll be glad that you did it in the long run. I'm going to put this magazine back, and I'm going to do one more round of the deep tissue massage, and then you'll be done for the day. All right? Okay. Now, let me make sure I have all my materials with me so I don't leave anything behind. Okay, are you ready to do your third and final round? Great. Remember, breathe, relax as much as possible. I will begin. I'm going to start right up here and work my way back. Okay? Just remember to breathe. That's good. I am massaging a little harder this time because this is your final one. You will find with me that the final round will always be a little bit more intense. Challenging, I like to say. We don't like to use the word painful because this is healing. This is a healing process. And sometimes, okay, I'm going to the back just above your shoulder blade. Sometimes we have to work for the good. There we go. Okay, relax, relax. Okay. I would like for you to, right now, I'd like you to do the range of motion. Yes, I'm going to grab here and bring your arm up. Bring it up as high as you can. Very good, very good, very good. And relax and bring it back down. I'm going to come right back. We're not going to rest. I'm going to massage in here again. You're doing great. Just breathe. It's all right. Don't tense up. Don't tense up. Try to relax all that. I'm going to go to the back. Very good. Okay. And we're going to get straight from that into the range of motion again. I'm going to grab the top of your shoulder. Bring your arm up as high as you can. And down. And relax. Last time. All right, here we go. Deep massaging. Breathe normally as you can. Okay, very good. Going to the back. Okay. And one more time with range of motion. I'm going to grab your shoulder, bring it up, and down. Very good, very good. You're a good patient. Much easier to work with. Some people are not that good. Okay. Now, I'm going to do this again, right here, the rounded part of your shoulder. And we'll do a couple more range of motions, and I'll stop after that. So I'm going to just massage deeply into your shoulder, down right here. Work out these knots. Okay. Now, I'm going to do two ranges of motion again. I'm going to grab your shoulder, a little pressure, bring it up, and back down. One more. Here we go. Bring it up. I want you to bring it up as high as you can. And pressure. Bring it way up, way up. That's good. That's good. That's good. Hold it. And then bring it down. And let go. Very good. Very good. You did a great job. I'm going to put this back now. I had to move it aside while we did that. I'm going to put this back. You were very dehydrated when you came in, so I'll make sure you get your fluids while you're supposed to. Okay, wonderful. Now, I'm going to make some notes in my chart here, and I'm going to talk to the doctor. Actually, I'm going to go make a phone call as soon as I leave here to let them know about the pain that you felt in your leg and the swelling right under here. And the doctor may come in and see you later about that. I'm not really sure. It depends on the schedule. But it is nice to meet you. Very nice to meet you. And do you have any questions? Do you have anything? Okay. It probably will be about this time. So it will be just before lunch. And it will be for at least the next 7 to 10 days we'll be doing this. And of course, again, as I said, as you are able to start walking some, we will do some different therapies. We'll do some different work together after that. But at this point, for now, until we know what's going on with the swelling and your leg, I want to limit our sessions to just this area right here. Okay, then that's for now, that's what we'll work on. That may change depending on what the doctor says. But for now, that's what we're going to do. Okay? I'm very glad that you're here. And it sounds like you are definitely in a good position to make some real changes in your life, and I'm very glad, very happy for you and your family that you have come so far already. It's going to be a tremendous help in your detox and your therapy process. Okay? And again, it was a pleasure to meet you. Okay, do you need anything before I go? All right, great. Well, I will talk to the doctor, and I will see you tomorrow. Great. Oh, thank you.